Thank you, sir. My health is good. सर, मैं सबसे पहले सरकार को बहुत बहुत धन्यवाद देना चाहता हूं कि इस बजट में हमारे केंद्रीय बजट हेल्थ केयर बजट को उसमें 11% की वृद्धि हुई है। इसके लिए मैं वित्त मंत्री जी और हमारे बहुत ही डायनामिक मंत्री नड्डा जी, उनके पूरी टीम, हमारे प्रताप राव यादव जी भी हैं, अनुप्रिया जी भी है, उनको बहुत बहुत मैं बधाई धन्यवाद देना चाहता हूं। Sir, few things which I am very pleased about in the budget. One is the commitment to increase medical seats, 10,000 medical seats next year, and 75,000 medical seats over 5 years, which I think will significantly improve the healthcare infrastructure in our country. मैं मुंबई से आता हूं। मुंबई में एक बहुत बड़ा ट्रेंड है, उस ट्रेंड का नाम है फास्ट कॉमर्स। फास्ट कॉमर्स की वजह से गिग वर्कर्स जो है, गिग वर्कर्स बहुत उनकी वृद्धि हो रही है। और नड्डा जी, आपने जो आयुष्मान भारत को गिग वर्कर्स तक एक्सटेंड किया, इसके लिए मैं आपको बहुत बहुत धन्यवाद एवं बधाई देता हूं। सर, मैं अपना बजट, ये स्पीच एक ही विषय पर फोकस करना चाहता हूं। मेरे पहले कई माननीय सांसदों ने कम्युनिकेबल डिजीजेस पर जोर दिया। प्रिवेंशन इज सर्टेनली बेटर देन क्योर। मैं एक ही नॉन कम्युनिकेबल डिजीज पर अपना बजट की स्पीच पर फोकस करना चाहता हूं। सर, रिसेंटली द प्राइम मिनिस्टर लॉन्च्ड a very positive campaign to curb, to spread awareness about the growing obesity trend in India, and I'm very grateful to the government for doing that. I think one thing we have to be extremely aware of. आज यदि हम अमेरिका का उदाहरण लेंगे, अमेरिका में ओबेसिटी यह केवल एक स्वास्थ्य की समस्या नहीं है, मैं मानता हूं कि एक बहुत ही बड़ा आर्थिक क्राइसिस है अमेरिका में। और भारत के लिए अमेरिका से क्या लेसन्स है, मैं कुछ स्टैटिस्टिक्स हाईलाइट करना चाहूंगा। आज अमेरिका में 42%, staggering 42% of adults and 20% of children in the US are obese. And this is a sharp rise of 30% from just 2 decades ago. Obesity-related illnesses in the US today are accounting for $1.4 trillion annually, which is 7% of the country's GDP. In fact, 1 in 3 deaths in the US, if you take all deaths, accidents, diseases, 1 in 3 deaths can be linked to obesity-driven diseases like diabetes and heart disease. Sir, it's very clear for India, if we do not act now, we could potentially have an obesity crisis in our country. There are few statistics, Nadda ji, I would like to highlight. In just 5 years in India, obesity among men has risen from 19% to 23%. Among women, from 21% to 24%. This is as per the National Family Health Survey data. कई लोगों ने मेल नरिशमेंट के बारे में बात की। मेल नरिशमेंट, द गवर्नमेंट इज डूइंग एन एक्सेप्शनल जॉब. दैट इज वन एक्सट्रीम. वी गेट टू सी दैट प्राइमरीली इन रूरल एरियाज, वेयर ऑलमोस्ट a third of children under the age of 5 have stunted growth, are underweight. But the other extreme, which we see in cities especially, is obesity among children. Today, overweight children have increased by 60% in the last 10 years. And by 2030, it's estimated that obesity-related healthcare costs, in America that number is 7% of GDP. In India, in 2030, that number could be as high as 1.6% of our GDP, or 7 lakh crore rupees annually. इसलिए obesity मैं मानता हूं कि एक स्वास्थ्य की समस्या नहीं, बल्कि एक बहुत ही गंभीर आर्थिक चुनौती है। और अगर इसे रोका नहीं गया तो बढ़ते हेल्थ केयर जो कॉस्ट है और घटती प्रोडक्टिविटी भारत की लॉन्ग टर्म आर्थिक प्रगति को अफेक्ट कर सकती है। अमेरिका का उदाहरण मैंने इसलिए, एग्जाम्पल मैंने इसलिए लिया क्योंकि अमेरिका ने कई सालों से, कई दशकों से ओबिसिटी को एक प्रकार से इग्नोर किया। और आज मैं दो देशों का उदाहरण देना चाहता हूं, सिंगापुर और जापान, who are proactively fighting obesity and ensuring that nobody in their country is obese. I'd like to share some initiatives that they've launched. सबसे पहले जो नई सरकार है यूएस में, नड्डा जी जो हेल्थ सेक्रेटरी है, कुछ समय पहले उनको कंफर्म किया गया, रॉबर्ट कैनेडी जूनियर, उन्होंने सार्वजनिक रूप से कई बार कहा कि his mandate is to prevent obesity in America, and they have a slogan there called MAGA, Make America Great Again. His campaign is called MAHA, Make America Healthy Again. Few initiatives that they've announced. One is to impose hefty taxes on sugary drinks. Second is calorie labeling in restaurants to help consumers make more informed and healthier choices. Their school nutrition programs, very, very stringent audits that they are implementing. But Japan has some very interesting policies. जापान में एक लॉ है, कानून है, मेटाबॉलिज्म लॉ। उस कानून 40 वर्ष से अधिक उम्र के लोगों के लिए रेगुलर कमर माप करना उन्होंने अनिवार्य बनाया। कैन यू इमेजिन, 40 years and above, regular waistline measurements have become mandatory. They are mandating that companies in the workplace must implement healthier choices. Japan has another big problem. They have an aging population. So the government has massive interventions, lifestyle interventions, to ensure that people get married, people have children, but also to ensure that workplaces are healthier. But I think the most stringent regulations are from a small country, Singapore. Singapore has recently completely banned advertisements on high sugar products that are targeting children. They have, Nadda ji, if you remember once during a question, I had raised a point, उनकी जो FSSAI equivalent है, उन्होंने एक न्यूट्री ग्रेड लेबलिंग सिस्टम स्थापित किया है फॉर पेरेंट्स। जब वे कन्वीनियंस स्टोर में जाते हैं, किराना स्टोर में जाते हैं, सुपरमार्केट में जाते हैं, समटाइम्स पेरेंट्स डोंट नो व्हाट इज अ हेल्दी प्रोडक्ट, व्हाट इज अनहेल्दी प्रोडक्ट। दे थिंक अ फ्रूट जूस which is actually a sugary drink is a healthy drink for my child. They have mandated a nutri labeling, simple, A to D, A, B, C, D. For example, a cola drink will be labeled D, very large D letter, so the parent will know in 1 second that is an unhealthy product. A freshly squeezed juice, for example, squeezed that morning, that will be labeled A, the parent will know that is a healthy product. And in between will be B and C. Therefore, my suggestion would be few very bold reforms to align with the Prime Minister's vision to ensure that India is obesity free in the coming years and we don't have the health crisis that we have in the US. Very, very briefly. One is, I think, an increase on taxes on sugary drinks, ultra-processed foods to curb and to reduce consumption. Secondly, getting FSSAI to have mandatory front-of-pack warning labels on high sugar, high salt, and trans fat foods which cause obesity. Thirdly, in primary healthcare centers, routine body mass index and metabolic health screenings to know if a child is developing obesity at an early age. Fourthly, I think the time has come, Nadda ji, that we must consider a complete ban on advertisements of high fat and high sugar foods that are targeting children. मेरा मानना है कि this is something which maybe the entire house can agree on. सर, आज विश्व में लोग क्या कह रहे हैं कि sugar is the new tobacco. जिस प्रकार से 20 साल 30 साल पहले tobacco companies used to target young people to sell them cigarettes, today that is what is happening with sugary foods. The last point, midday meal scheme is doing exceptionally well. Government of India is ensuring that it's implemented well. Perhaps we can also do regular audits to ensure that the nutritional content is effective. I would only like to say one last point, that भारत की जो सबसे बड़ी जो asset है वो हमारी young workforce है. Europe, US, China, Japan, all countries are facing an aging population. Just like education is very important, skilling is very important, making sure that they are healthy, the next generation are not stunted, they are not malnourished, they are not obese. This, in my opinion, is very critical. I have no objection to importing the best American technologies that help our workforce. but I'm against importing American lifestyles and their obesity epidemic. And that is something we have to be very, very careful. I think if these steps are implemented, these will align with the Prime Minister's vision and ensure that our future generation is healthy for the years to come. Thank you very much.